So good morning, everyone. I suppose really where we're at in thinking, I just think we can follow on maybe quite logically from our previous two speakers. Whenever some of the key themes I think we could hear in terms of the strategy and strategy development of both the North and South HRB and R&D division is very much a focus on partnership. We've heard infrastructure and we've heard the words around research capacity building. And what I propose I'm going to look at is really asking the question, what is the state of palliative care research in Ireland? So later on today, we will be launching our new strategy for the next 5 years, building on from now right for the next 5 years. But I think in the very early days, whenever I first started working with the Institute, one of the key things we wanted to look at, and which I led on, was looking at a systematic review of the evidence around palliative care research based on published literature. And this dated back from 2002 to 2012. So it was to try to ascertain a baseline of where we were, drawing on a particular source of information, which was the published literature, to see, okay, how can we use that information to see, well, what's been going on in terms of palliative care research in Ireland? Who is doing what? Where are we building on? And all of the key emphasis there. And that piece really sort of flagged and was useful to help us get a baseline and to think about maybe looking at identifying future priorities and where we would go and inform for the future. So as any good researcher, you think, okay, well, that was up until 2012. So what's happened since? So if we try and take a picture, and this is really only a picture of the published literature from 2012 to 2017, what is it telling us? What is it informing? What can we see with regards to how we've developed, where we're moving, and maybe also, again, help inform future development? So we have heard, and very much if you think back to the overall aim and the vision of the All-Ireland Institute, that it was always linking in research to inform policy and practice. And I think even from our previous presentations, we know the value of health services research and having research that has an impact in relation to the service and service provision. And that was always a key aspiration and a goal in relation to the Institute, where we were linking policy and practice, research and education, that it was always the three elements that would be the pillars that would one impact onto the other. And there is evidence that palliative care research can be used to inform policy and practice. And also, whilst there has been significant developments over the last number of years, looking at a global mapping of palliative care and palliative care service provision, and this is can be seen in the AIIHPC Atlas, this has not necessarily included research. So whilst we can say that looking at the service provision across different countries globally, and we can see how they've developed, how specialist palliative care services have developed, it's not explicit in relation to the research and the research side. So there's a gap there as well. And yet we know that the research and the practice can be very closely linked, but yet we don't have the evidence around that. And that in terms of the quantity of palliative care research, and that was what the previous systematic review that I undertook did show, that we could see an increase in the quantity of our palliative care research, it was often through small-scale, needs-based studies, and that when we looked at, and building on from Mairead's point around when we looked at interventional studies around effectiveness and cost effectiveness, they were largely absent. And again, there's other studies would indicate that in terms of palliative care. And in the Irish context, if we think of where we've come from, we have had investment in palliative care research. So we have the setting up and the establishment of the Palliative Care Research Network, and we've had investment around setting up All-Ireland Institute. That's why you're all here today. But questions still remain around the impact and the current state. So what I aimed to do was to undertake and identify and again look at palliative care research on the island of Ireland taking over a 5-year period. So building this from 2012 to April 2017. So this is almost hot off the press, okay? So we've been working on this over the last few months. And we wanted to look at a systematic mapping review. And in this, in terms of doing a mapping review, the aim of it is to map out and categorise existing literature as a means of commissioning further reviews in primary research by really looking to get, well, what are still the gaps? So where we are in terms of the Institute and moving on and what you'll be contributing to discussions later on is actually seeing where would our priority areas be. And we know issues in our demographics and the work that was mentioned in relation to dementia. We know some of the challenges are there. We know the evidence base is increasing. But this was looking at using this particular approach. Just again, to give you a sense of, these are the databases that were searched. We also looked at wanting to include grey literature, and this was using through our key networks in the palliative care researchers in Ireland. We had our terms that were built on from before, so giving on our previous review, we've actually had colleagues in Scotland who actually had adopted our approach to get a sense of what was the picture in Scotland as well. So I see David's here now and arrived, so that's where we were building on. And we also set our inclusion and exclusion criteria applied to the titles and our abstracts. So just looking at some of our inclusion and exclusion criteria, we looked at research that's focused on palliative and end-of-life care, published between the time that I've said, that we had more than one author that was based in an Irish institution, that it was focused on primary research, and that also did include some quality improvement type projects there as well, but it was mainly research. And you can see there in terms of English language. We excluded other projects that were published before that date, and that data were collected in Ireland, but none of the authors were Irish-based. So we really wanted to get a sense of how much of ownership of this is located around Irish context. So again, just to give you a sense, we had 1,073 articles that were retrieved. Then we went through our process of screening and titles and abstracts, and we came that we had 151 papers that were included in the final analysis. I just want to draw out some of the key pointers in relation to looking at, from a strategic point of view, around some of the key messages that could perhaps be looked at. And when we looked at the source of funding, we could see that the sources of funding were diverse, that we had particular investment which would reflect what we've had in relation, and you'll hear about the projects that were funded through the Atlantic Philanthropic Funding and through the HRB and through those developments. But whenever it came, we could still see that over 13% of the research that was ongoing and had been completed was unfunded. And I think, again, for some of us who've been working in this area for a while, perhaps sometimes you take on research and you do it, and people in relation to particular projects that they do, that they remain unfunded. So I think just looking at where the funding came from. In looking at the number of publications over the period of time, as I've said, you can see that we had 151 papers were included. The palliative care research on the island of Ireland has doubled within the time frame from when we had in 2002 to 2012. So that was a 10-year period, and we now have double within the 5-year period. So that's, again, a way of demonstrating a significant increase, and actually it's almost like a return on investment, which I think is important. But again, we see an overall upward trend in the number of palliative care studies that are being published. In looking at the publication source, again, we do have, again, just to indicate, the main journal is Palliative Nursing, but some key messages that are here is we've had an increase in the quality of the type of research or where the journals are being published, because we do have Palliative Medicine, and these are some of the top journals within the palliative care field, and the Journal of Pain and Symptom Management, and also BMC Palliative Care. So these are more high-impact journals. So that would indicate and would give us a sense of the quality of what we're doing. If we take it that it weighs out, now we can debate that in relation to impact factors in journals, but we are publishing in better journals than what we had previously. And also this time we did really try to get a sense of, because we were aware that we had undertaken significant investment around building doctoral capacity and research capacity, that we wanted to see where we were with the PhDs and the MSc projects, because they didn't always get into the published literature. So looking at the grey element, that we could see that the PhDs were the 5th most common type of publication. In looking then at the research, and suppose the type of research, again, we have, again, these are just sort of high-level quick messages, but about the quantitative methodology and then closely followed by qualitative. But again, these are the type of, similar to really the previous project. I suppose one of the key things to pull in there that I haven't highlighted is when it comes to interventional studies, that's not, I think I have this towards the end, we haven't really developed in relation to that, and randomized control trials to include within this review. In looking at where the data collection, we could see that the majority of data was collected across the 2 jurisdictions of Ireland. And this would clearly indicate, if we're a lot of what we're talking about, we are seeing some evidence of collaborative working. So we're seeing joint working across the 2 jurisdictions there and building across, which is, would like to think in terms of a network that would happen, but it is reassuring that it is happening. But the other key message that's there is that we are really clearly seeing a lot of the international links coming through, and that we have 23% of the studies have included data collection that are outside of Ireland and the UK. So again, in terms of reaching out and building that wider picture, that is actually happening in the published literature coming through. In thinking of the setting, and again, building from before, and if you look at the model of palliative care and where we need from the previous review, one of the key things that was identified was that we didn't have a lot of research that was focused within the primary care setting and within community. And yet this is, in terms of our policy direction, both north and south, a key aspect that we need to be thinking of and developing. But what we can see is that the community settings were becoming the most popular setting for these projects that were being undertaken. And when I talk about community, we're including home care and including care homes and hospice within that. But then you can also see that we have then in relation to other and GP practices. So there's a general movement to think about the primary care, and given one of the top priority areas that's been identified at the recent palliative and end-of-life priority setting exercise was that we had to think about 24-hour provision and outside hours. So there's some areas, still movement there needed, but some move around that. In thinking then of the type of participants who were involved in these projects, we still see quite a big emphasis in relation to recruiting and doing projects with healthcare professionals. Second, the main group, as you probably would expect, is a focus on patient and carers, but there's other mixed groups across them all. But there is still an emphasis on healthcare professionals, but coming through the patients and carers were the most commonly recruited population. Looking at what the focus was, or the foci, in terms of the projects and mapping them around what the key aspects were, some of them still had non-cancer was a common theme, which again for people, and most I'm speaking to the converted largely within this room, but one of the key moves in relation to palliative care over the last decade has been to include a focus that isn't just in relation to cancer, but to include non-cancer and non-malignant as well. So that would reflect almost like the state of movement in relation to palliative care, and also then an emphasis on looking at knowledge and training, and again the management of symptoms. Still have a focus in relation to needs and experiences, which is still important to have, and also then some focus around moving towards last days of life. Largely the themes then mapped across to those areas. So in conclusion then, it was just to think about what are some of the key messages that the Institute could take forward in relation to what is the state, what's the state of play of palliative care research over the last 5 years. So what we continue to see, which is encouraging, is an upward trend in the number, quantity and quality of the published papers that have been undertaken. We can see evidence of building research capacity. I think the very fact we have everyone within this room as well, but if you want to have your evidence base around some of it, we can see an increase in the numbers of PhD students and a greater development in relation to our different approaches, and more innovation around our research design. We can see greater collaboration across the island of Ireland, which is evident through the way that we're undertaking the research, and even the networks and its linked to national networks, and that the international collaborations are developing. So that still needs further support and enhancement. I'm not saying that we're there yet at all, and there's a lot of work still to support that. But if you wanted to demonstrate and think, well, the international collaborations are starting to be evident in relation to the published literature that's coming through, and in the relationships that the researchers and the research community in Ireland have, and probably in other projects and other research grants and projects that are ongoing and in development as well. We do have an ongoing development that's focused on non-malignant and non-cancer, which again reflects the models of care that are needed, and also a focus that is looking at the models of care provision, of palliative care provision that's needed within the island. So as I've said, in terms of having a focus on the community and research that's undergoing and working within the community and trying to address some of the priority areas that have been identified. I suppose one of the key questions is still around investment. And we've heard from some of our research funders here and from other within the room. But I think in terms of the investment, it's important to note that the investment remains diverse. It is limited in some extent, and we have the evidence if we compare. There's been work undertaken within the UK. If we look at the percentage of investment that goes into palliative care research versus other types of clinical, in particular the wider field of cancer research, it's like 0.1%. So I think it's important that we have been encouraged by the developments and evident here, but that it is limited, and we need to think around sort of addressing that. But also some underfunded work continues, and that needs to be really thought through in relation to how we can sustain and build that sort of activity, that we need to look and address that. And that in moving the whole work, so that there is a need for larger funding for larger scale collaborative projects. And I think, as Regina alluded to, there's been some opportunity that we've started to have some momentum, and I think we're ready in terms of our skills base and the development and the relationships to build and sustain on those. But that's a key element for us to be moving forward to, because again, while we have seen developments in the methodologies and the different innovative approaches there, when we looked at, again, still looking at some intervention type studies, they were still lacking. We had some developments in relation to health economics, and I know of some colleagues in the room who have led a lot of that work, but we still have more work in relation to build and sustain on. So I suppose the key messages are, it's a picture. It's a snapshot that hopefully gives us some key messages that the Institute can take forward, and ourselves and the wider community, around how that will help to inform the strategic, given the context that we're in within Ireland, the context of our different healthcare strategies and for research that are there, and the work that we're taking forward, and even also that you can inform some of the future discussions later today in relation to the All Ireland Institute research strategy. Thank you.